Hello, my name is Derek Hokinson, and I'm a Medicare broker with Essential Solutions. Today I'm going to take you through the Introduction to Medicare course put out by CMS, which is the Center for Medicare and Medicaid Services. Welcome to the Introduction to Medicare. I need to take a moment to go through the disclaimer with you. While all information in this document is believed to be correct at the time of writing, this computer-based training is for educational purposes only and does not constitute official Centers for Medicare and Medicaid Services instructions. All affected entities are responsible for following the instructions found in the MSP web user guide found at the following link. The Introduction to Medicare course provides background and history on Medicare, a comparison of Medicare and Medicaid, an explanation of entitlement, including age, disability, and end-stage renal disease, and concludes with the parts of Medicare. Medicare is a broad program of health insurance designed to assist the nation's elderly to meet hospital, medical, and other health costs. Medicare is available to most individuals 65 years of age and older. Medicare has also been extended to persons under age 65 who are receiving disability benefits from Social Security or the Railroad Retirement Board and those having end-stage renal disease. There are currently over 55 million people enrolled in Medicare. The CMS is a federal agency within the United States Department of Health and Human Services that manages Medicare. History of Medicare. In 1965, Medicare was enacted as health insurance for the aged, Title 18 of the Social Security Act. Medicare extended health coverage to almost all individuals aged 65 or older, i.e., those receiving retirement benefits from Social Security or the Railroad Retirement Board. Medicare eligibility was extended to individuals under age 65 with long-term disabilities and to individuals with ESRD in 1972. In 1973, the HMO Act provided for startup grants and loans for development of health maintenance organizations, or HMOs. The Healthcare Financing Administration, now known as the Centers for Medicare and Medicaid Services, was established to administer the Medicare and Medicaid programs in 1977. In 2003, the Medicare Prescription Drug Improvement and Modernization Act created significant changes to Medicare, including Part D prescription drug benefits and Medicare Advantage plans. Both became available in 2006. Medicare versus Medicaid. People often confuse Medicare with Medicaid. They are two entirely different programs. Medicare and Medicaid were both enacted as part of the Social Security Act, and the programs provide comparable services. Medicare provides health insurance coverage to individuals who are age 65 and over, under age 65 with certain disabilities, and individuals of all ages with end-stage renal disease. Medicaid provides medical benefits to groups of low-income people, some who may have no medical insurance or inadequate medical insurance. Medicare is strictly a federal program. Although the federal government establishes general guidelines for Medicaid, the Medicaid program is administered by the states. Entitlement to Medicare. Medicare Part A, also referred to as hospital insurance, as well as Medicare Part B, or supplementary medical insurance, are available to three groups of insured individuals: the aged, the disabled, and those with ESRD. Following is an explanation of how an individual becomes insured, as well as an explanation of the eligibility requirements for each group. Medicare eligibility, age. An individual aged 65 or older will generally be entitled to Medicare if he or she has worked at least 10 years in Medicare-covered employment, i.e. paid the applicable FICA tax. A person aged 65 or older may also be eligible for Medicare if his or her spouse has worked at least 10 years in Medicare-covered employment. Typically, Medicare coverage begins the first day of the month in which the individual attains age 65. The date of Medicare entitlement is, however, dependent upon the month of enrollment. Medicare eligibility, disability. In order for an individual to become eligible for Medicare due to disability, the individual must have a medical condition that meets the Social Security definition of disability, and the medical condition is expected to last at least 12 months. The individuals must also receive disability benefits from Social Security or the Railroad Retirement Board for at least 24 months. The 24-month waiting period is waived for individuals that suffer from ALS, also called Lou Gehrig's disease. These individuals are eligible for Medicare the first month of disability benefit entitlement. Medicare entitlement disability. If a person becomes disabled on June 15, 2008, Social Security disability benefits would first become payable in December of 2008. Disability benefits commence the sixth full month after the date of disability begins. After a person has been entitled to disability benefits for 24 months, he or she is entitled to Medicare. In this example, Medicare entitlement begins on December 1, 2010. Medicare entitlement, ESRD. Eligibility for Medicare coverage because of end-stage renal disease is for patients for whom a regular course of dialysis or a kidney transplant has been prescribed by a physician because they have reached that stage of renal impairment that a kidney transplant or regular course of dialysis is necessary to maintain life. Eligibility to Medicare is not automatic. These individuals must have applied for Medicare benefits and been approved for Medicare coverage by Social Security or the Railroad Retirement Board. To be eligible for Medicare, the patient must have worked long enough under Social Security or Railroad Retirement, been receiving or eligible for Social Security or Railroad Retirement Board benefits, or be the spouse or dependent of a person who has worked the required amount of time, or who is receiving benefits from Social Security or the Railroad Retirement Board. Medicare Entitlement, ESRD. Usually, Medicare coverage begins the first day of the third month after the month in which a regular course of dialysis begins. For example, if a person begins a regular course of dialysis on July 22, 2008, Medicare coverage would become effective October 1, 2008. Medicare Entitlement, ESRD. Medicare coverage can start as early as the first month of dialysis if the person begins self-dialysis training before the fourth month of dialysis and the person expects to finish training and undergo self-dialysis treatments. For example, assume a person starts regular dialysis on July 23, 2008. This person completes a course of self-dialysis training in September of 2008 and starts undergoing self-dialysis. Medicare coverage would begin July 1, 2008. Medicare Entitlement, ESRD. Medicare coverage can also start earlier in circumstances where a patient is admitted to a Medicare-approved hospital for a kidney transplant and the transplant takes place within the same month or the following 2 months. For example, if a patient commences dialysis on November 22, 2008, and then is admitted to the hospital for a transplant that occurs December 3, 2008, Medicare would become effective December 1, 2008. Medicare can begin earlier based on a kidney transplant, even if a person was not on dialysis prior to that transplant. Parts of Medicare. Original Medicare consists of Medicare Part A, hospital insurance, and Medicare Part B, medical insurance. Medicare Part D, prescription drug coverage, can also be added to original Medicare when a beneficiary enrolls in a Medicare prescription drug program. Other people have their Medicare coverage through a Medicare health plan like a health maintenance organization or HMO, or a preferred provider organization or PPO. These plans are called Medicare Advantage plans or Medicare Part C and are offered by private companies. These plans may also include prescription drug coverage and other benefits that are not offered under original Medicare. Medicare Part A coverage. Medicare Part A covers inpatient care received in a hospital or skilled nursing facility. This includes a semi-private room, meals, skilled nursing and rehabilitative services, and other services and supplies needed. Home health care services are covered by Medicare Part A. Covered home health care services include medically necessary part-time or intermittent skilled nursing care, physical therapy, speech, language pathology, and continuing occupational therapy. Hospice care benefits are available under Medicare Part A for people with a terminal illness who are expected to live 6 months or less. All Medicare-eligible individuals are automatically enrolled in Part A. Medicare Part B coverage. Medicare Part B, medical insurance, helps cover doctor services and outpatient care. It also covers some other medical services that Part A doesn't cover, such as the services of physical and occupational therapists and some home health care. Part B helps pay for these covered services and supplies when they are medically necessary. Beneficiaries must elect to enroll in Part B. Examples of services covered under Medicare Part B include ambulance, lab services, diabetic supplies, doctor services, durable medical equipment, emergency room services, flu shots, screening mammograms, outpatient mental health services, physical therapy, tests, and certain transplants. Medicare Part C coverage. Medicare Part C or Medicare Advantage plans provide an alternative to coverage under original Medicare. Medicare Advantage is a health plan option similar to that of an HMO or a PPO. Medicare Advantage plans provide all of a person's Medicare Part A and Part B coverage. This means that each Medicare Advantage plan must cover at least all of the services original Medicare covers. Many Medicare Advantage plans include prescription drug coverage. Some plans may offer extra coverage such as vision, hearing, dental, and/or health and wellness programs. Medicare-eligible individuals may join a Medicare Advantage plan if the individual has Medicare Parts A and B, lives in the service area of a particular plan, and have not been medically determined to have ESRD prior to enrollment. Medicare Part D coverage. Medicare prescription drug coverage, which began January 1st, 2006, helps to pay for brand name and generic drugs. Medicare beneficiaries must choose and join a drug plan to receive the coverage. The drug plans are run by commercial insurance companies and other private companies. All drug plans must offer coverage that meets or exceeds the standard drug plan benefits as defined by the government. Key concepts. This course has covered general information about Medicare, a timeline of important milestones in Medicare history, the similarities and differences between Medicare and Medicaid, ways to become entitled to Medicare based on age, disability, and ESRD, and the types of benefits covered by Medicare's Part A, B, C, and D. You have completed the Introduction to Medicare course. Information on this course can be referenced by using the CMS website found at the following link.